Okay, so let us address how we might attempt or go about speeding up recovery from training, from performance. And I guess a couple of things that we need to get clear from the get-go is that we need to understand clearly the concept of DOMS. The concept of DOMS. So let me introduce you to this. Some of you may already know it. It is the idea of the delayed onset, and there's a little of over here, of muscle soreness. The delayed onset of muscle soreness. And what we're talking about here, and I'm sure you've experienced it, is this notion that you train or you perform particularly hard, often with lots of plyometric type movements and exercises, and as a result of that, you experience pain, you experience tightness, you experience lack of elasticity of the muscle I'm talking about. Lack of elasticity and pliability of the muscle. Okay, and this tends to happen 8 to 48 hours after performance or after training. Okay, so I'm sure you guys have experienced this to some degree. Maybe you've trained particularly hard, or you've been out of season, you come back to pre-season training, something like that, and you get this experience. Now, what I want to address with you is that we've kind of got two factors at play here. The first one is what we call, and this is really the minor factor in my opinion, we've got the idea of a lactic acid residue. So we might have some build-up, some residue, some leftover of lactic acid which has been produced in the muscle anaerobically during that sort of heavy exercise bout. But the other point, and I think this is far more relevant, is the idea of micro tears. And micro tears in the muscle fibers, usually at the insertion end of a muscle, cause a process of inflammation and the inflammatory response, and that causes the body to fire and send large amounts of nutrients to that site, and that causes the inflammation, which can then cause the stiffness and the pain. So a lot of what we want to talk about within this particular tutorial is the notion of how do we reduce DOMS. How do we reduce DOMS? Okay, so that's really what we're looking to address within this section. And a couple of techniques that can help. The first one is the idea of massage. Now, obviously, I've included an image here of hands manipulating a quadricep here, because that massage can help with a couple of things. First of all, the key point I've mentioned there, and the word I mentioned there, of manipulation of the muscle, is an important term. The second one is we are kind of literally and practically removing lactic acid. In this sense, we're almost squeezing it back up out of the leg in this context. So we've literally got this removal of lactic acid, this literal removal of lactic acid. The second point I would make, and it's kind of illustrated over here with what I personally find a kind of an interesting and humorous image, is we've got the notion of ice, or we've got the notion of cooling. So a couple of points that we can make here. People often use methodologies such as ice jackets, which we could have had pictured here. Ice jacket would be effectively like an ice pack that you can wear around your upper body. We've also got the idea of ice baths. And this, of course, is what we've got in the image here, with two, what I imagine, are rugby players, possibly, in an ice bath. And if you've never experienced this, I would really encourage you to do so. It's a very difficult thing to do because getting into extremely cold water is challenging, really, really challenging thing to do. And finally, we've got the notion of cryotherapy. And cryotherapy is very temporarily entering an extremely cold environment where the air is extremely cold. And the idea of all of these methodologies is that when we enter that water, when we enter that cold water, that cryotherapy chamber, the blood is pushed deep within to the core of the body. Okay, so our blood flow is redirected back to the core of the body to prevent it getting too cold. And what happens is once we get out of that ice, the blood is then sort of effectively rushes back through the extremities, back through the other parts of the body, including the legs, the arms, the areas that have worked, the muscles that have worked. And this causes like a flushing action. And therefore we get this removal of lactic acid, and also the delivery of the nutrients to prevent DOMS as well. Now then, I want to talk to you about compression. Okay, and we've got this image here of compression, or compression. Let me write in compression clothing. compression clothing as a recovery method. Remember, we're not talking about wearing lycra during performance here, but as a recovery. So why would we wear these tight-fitting trousers, for example, after we've trained? Well, the main point is that they increase, up arrow, VR. This is venous return. The amount of blood returning to the heart is increased through the use of compression. And it's particularly important in what we refer to as the extremities, the legs, the arms, because it's at those points that blood pressure is at the lowest, so therefore the least tendency for blood to return to the heart, venous return. So therefore, we've got this idea of compression helping blood return to the heart. Starling's law tells us this if venous return is higher, then stroke volume will be higher. In other words, we can deliver more nutrients after exercise that are needed. Now, let me jump ahead here and talk about one over here. I'm going to come back and fill this little. Let me choose a different colour. Let me choose this colour. So over here, we're going to talk about the notion of nutrition as a recovery method. Nutrition. And there's 2 points I'd really address for you in terms of nutrition. First of all is after heavy training or heavy performance, we may well take something like a protein supplement. Remember, proteins, amino acids, their primary responsibility is to repair and rebuild tissues or to grow tissues. So therefore, repairing things like micro tears is very useful to have large amounts of proteins in our system. And the other sort of idea of nutritional sort of recuperation is the idea of carbs or carbohydrates, and this is replacing the lost energy which can then be stored as glycogen in the liver and in the muscle. And finally, I want to talk just here about the idea of what we might loosely call wet ice packs. Wet ice packs, and these are really particularly good in hot conditions. Okay, so I mean, maybe you want to picture a tennis player at the change of ends in particularly hot conditions might do something like this. And what we might find is that this towel here, which we've got wrapped around the neck here and going around the shoulders, maybe this is cold. It's wet. Okay, and what's happening is that the blood which is passing via the skin around the neck, which is very large amounts of blood, by the way, that is being cooled as a result of passing by this wet towel. So this hot condition, wet ice pack around, especially around the shoulders, is a really effective way of cooling down. And of course, if we manage to cool down faster, more efficiently, we're more likely to recover rapidly. We're more likely to provide the energy we've got to recuperative processes such as the removal of lactic acid, and therefore we're better able to prevent DOMS. Cheers.